Boundaries are essential. They keep us from knocking into each other, or worse.
We are very vulnerable.
You have to pay attention, though. It's easy to get distracted.
Us in court in no time
Oh my
whatsoever.
God, watch out!
A few more feet, and they'd be sailing down that slippery slope. Hello and welcome. I'm Paul Anthony. Just as boundaries and warning signs help us to get around safely in a car, they also exist and help to maintain good doctor-patient relationships and all good healthcare provider-patient relationships. Knowing what the warning signs and boundaries are can help you recognize areas where you might be putting yourself at risk of sliding down the slippery slope of the doctor-patient relationship. The purpose of this program is to identify some of those boundaries so you aren't taken off guard if either you or your patient drift across them. For example, physicians often find themselves on that slippery slope when a family member, a friend, or a co-worker request a prescription for themselves or for a sick child.
Carmen.
Hi, Claire. How are you?
Fine, thanks. I'm glad I run into you. You're just the one I wanted to see. I need to ask a favor.
What's that?
My granddaughter is visiting me from Florida, and she has an ear infection, and I was wondering if you would write me a prescription for her.
How long she's been having this ear infection?
Well, she's just
No one wants to say no in this situation, and everyone likes to be liked and regarded as a good guy. But writing a prescription for anyone means you are providing medical care. When that person is a friend or family member, it places you in a dual role, sometimes an uncomfortable place to be.
Let me know in a couple of days how she's doing, okay?
Yes.
When you write a prescription, but fail to do the things you would normally do, such as examine the patient and record the treatment in a medical record, you may be putting yourself and your patient at risk. Think twice before providing casual care of this type. It may be wiser to say no the first time someone asks.
Hey, how are you?
Good. I wonder if you could do me a favor.
If I can.
My daughter has a sore throat again, and I think it's her sinuses. Do you think you could write me a prescription for an antibiotic?
I'd really like to help Harriet, but I think she needs to see her own doctor. If she's really ill, she deserves to be seen.
You're probably right.
Whenever a doctor accepts a dual role, such as being both physician and friend, the doctor still needs to observe the boundaries of patient confidentiality. You need to be vigilant about protecting the privacy of your family and friends, just as you would for any patient. Many state laws are silent on the subject of doctors taking care of family members. But if you make the decision to provide care on a regular basis, not just in an emergency, and especially if you're writing narcotic prescriptions, your licensing board will expect you to meet the standard of care as documented in the medical record of each individual you regularly treat.
I think in any physician-patient relationship, a professional atmosphere is terribly important. That's what the patients expect, and that's what they deserve.
When your patient first comes in, what they see is how they first evaluate how their treatment is going to be. So if they come in and there are papers all over your office, if there doesn't seem to be a place for them in the office, if they're not sure of what where they're supposed to go, that confusion ends up causing a complication in the treatment.
I'm here to see Dr. Winter.
Creating a professional atmosphere in the office can encourage a positive doctor-patient relationship. Such things as the presence of a professional staff, maintaining a clinical setting in the office, and even wearing a white coat help to establish a professional tone.
Yeah.
Showing your respect for patients is absolutely key. After all, the patient is coming to you for help and assistance, and they're putting their trust in you.
I address patients politely, and I address them on a level that's not one of a friendly level. I address them on a level that it's clear that I'm trying to get information and that I'm interested in the information they have to provide me. When I do a physical examination, I do it in the presence of a chaperone at all times, both on males and females, and I explain to the patient what I'll be doing.
Here we are, Mrs. Ford.
Whether it's addressing patients by their last names,
Here, put this on for me, please. I'll be back in a few minutes and check on you.
providing adequate draping and privacy when they disrobe,
Mrs. Ford? Hi.
knocking before entering an exam room, or using chaperones. These practices keep the doctor's role clear to the patient by reinforcing a respectful distance and a professional atmosphere. Each doctor has his or her own style, and none of these practices is an absolute. But as a doctor deviates further and further from them, more and more ambiguity is introduced into the relationship. For some doctors, a hug or an arm around a patient's shoulder is a natural and genuine display of professional concern. It's important, however, to make sure the meaning is clear to the patient and deal with any misunderstanding immediately. Confusion about the proper doctor-patient relationship has also been created by the way physicians have been portrayed in popular culture, novels, movies, and television through the years. The image of the doctor as an available romantic figure has blurred the professional boundary lines between doctor and patient and hurt the primary goal of good patient care. The use of last names and other professional practices tell the patient that personal friendship and romance are not part of the relationship.
This happens all the time, and you are put in a very embarrassing situation that your friend or somebody asks you to write a prescription for you which you do not want to. And you really have to use all of your wisdom and tricks to tell them no, because it is illegal and it can cause problems.
The people that come in and ask for jury duty say, oh, I cannot serve on the jury because of any number of reasons. And my answer to all of them is, well, I go. I said, I have no excuse, and that's my duty.
All right.
If any of your patients fly the friendly skies, you may have been asked to help them recover the cost of an unused airline ticket by writing an excuse. If they were ill, there's no problem. But when they ask,
Now, is there anything else?
Well, yes, there is. Last week I was all set to go on vacation, and my work became such a hassle I really couldn't get away. And now I find that the only way I can get a refund on these tickets is if I were sick. Could you write me a note that said I had the flu or something?
Oh, you wouldn't ask me to do anything illegal now, would you?
sometimes humor can help get the point across. And sometimes just being human helps.
Okay, Mr. Shotwell, I think what we need to do is have you take a second course of this antibiotic. Your sinus infection isn't quite clear, but I think another 10 days will do it. So I'd like you to fill this and take every last pill.
Doctor, my wife has a prescription plan, and I don't. I'll be taking the medicine. It's just that if you could make it out in her name, it's real expensive. It would really help.
I'm sorry, I can't do that. I understand that this is an expensive medicine. Unfortunately, I think it's what you need. But patients often don't understand that if I were to write your prescription out in an incorrect name, that would be a falsification, and I could lose my medical license.
Whether it's a non-refundable airline ticket or the cost of a prescription, everybody can identify with money problems, and that makes it hard to say no. Whether it's an insurance claim, sick leave excuse, request for disabled tags, or a pardon from jury duty, falsifying any medical document is crossing a boundary line that can put your license in jeopardy.
Because we are physicians, we are given a tremendous amount of trust. We are given a tremendous amount of power, and we really have to be very, very careful how we exercise that power.
A patient will come and they will tell you things that they won't tell their closest friend, they won't tell relatives, they won't tell their spouse. Sometimes they'll bare their soul and tell you things that come from the innermost recesses of their subconscious. There's no balance in this relationship. The physician is holding the power over the patient, and it's inappropriate to abuse that power in any way.
Good morning, Mr. Lyon. How are you feeling today?
There are times a doctor may need to know intimate details about a patient in order to give the best possible care. This privileged information, combined with the doctor's medical knowledge, places the physician in a position of power and the patient in a position of vulnerability. This power differential is the reason that the doctor is always in charge of the relationship and responsible for maintaining the proper boundaries. Just as the driver of our car is responsible not only for his safety, but also for that of his passengers.
John, we're going to turn right up here, but I really wouldn't bother stopping. There's never any traffic at this intersection.
I think I'd better.
If the driver runs a stop sign because the passenger wants to, it's the driver, not the passenger, who will get the ticket. Likewise, the patient may also cross a boundary line by bringing the doctor an expensive present or suggesting that they develop a social or business relationship. Nevertheless, the doctor is still in the driver's seat and must maintain control of the relationship and act in the patient's best interest. When a doctor gets romantically involved with a patient, the outcome is almost always damaging to the patient. Consequently, many state licensing boards regard sexual relationships with patients as sexual misconduct in the practice of medicine. The fact that the patient was willing or even initiated the more personal relationship is not a valid defense. However, it's only fair to acknowledge that the doctor is caught in a dilemma. How do you show concern for patients and keep a respectable distance?
Making sure that the patient understands that your concern is a professional concern and a personal concern, but having to do with health and well-being and not a romantic interest or a personal interest or a desire for friendship.
It's the difference between empathy and sympathy, that I don't put myself in the place of the patient. I try and understand the pain that they're going through, but it's not my position to feel that pain. My job is to help them to feel better, not to help myself feel better.
Well, you know, a lot of this is personality, and I think we each have our own styles. I am a fairly, I guess that's why I went into pediatrics, a fairly cuddly, warm person. So I touch the elbow of the mother and say to them, hey, you're doing a great job.
Each patient's comfort level is different. Suppose you've just given a patient of yours the long-awaited good news about her condition.
All the tests were negative.
Thank you.
Okay.
Do you refuse the hug? Minor boundary violations of this kind are inevitable. Still, it's important to recognize the boundary, know why you're crossing it, and get back in your lane, so to speak, as soon as possible. Left unchecked, minor boundary crossings can lead to major problems down the road, as most licensing boards can attest. Being aware of the warning signs can help you avoid driving down the road to trouble. Here are some red flags that the doctor-patient relationship has started down that slippery slope of professional misconduct.
I know you're suffering from some stress. Believe me, I know what that's like. When my divorce came around, my wife got almost everything. She got the house.
You confide details of your personal life, especially unresolved problems, to your patients. You find yourself checking your appearance in anticipation of a certain patient's visit. You schedule the patient toward the end of the day so you'll have more time to socialize.
Here you go.
Thanks a lot.
So, what did you want to talk to me about?
Well, the plans have
You let your staff go early and maybe offer the patient food and drink.
That's a disappointment to sick. Susie, you can leave now. I'll lock up. Anyway, go on.
You exchange gifts, hugs, and kisses.
That is so thoughtful.
You offer free care.
Hello, Julia. Hi, this is Dr. Matz.
You call the patient at home when their condition doesn't warrant it.
Give you a call and see how you were doing.
Dr. Smith.
Oh, hi, Liz.
And you ask the patient to meet outside the office to discuss the case, away from the hustle and bustle and prying eyes of your staff. Once a doctor starts sliding down that slippery slope, it's an easy tumble into bed.
You'd love it.
Maintaining the proper relationship, the proper boundaries, means being consistent and following the rules with all of your patients. Your medical record should reflect everything that is going on with a patient, and you should be able and willing to discuss a potential problem with a colleague. By all means, if you are uncomfortable about treating a certain patient, and your personal feelings become involved, refer her or him to another physician. Be wise before a sexual relationship begins, because as far as the State Medical Board is concerned, there are no excuses and no buts about it.
But she was willing. But my patient was a consenting adult.
But it didn't happen at the office.
But once we started having sex, I didn't bill her anymore.
But I only saw her in consultation.
But in my country...
No harm was done.
Well, what's the big deal? Eventually we got married.
In fact, sexual misconduct by physicians causes enormous harm to patients. But therapeutic dialogue and a healing touch can do enormous good. Physicians must always keep the patient's well-being uppermost in their minds, using their knowledge and position only for the benefit of the patient. The key word is respect, and remembering that what is routine for the doctor is not at all routine and often scary for the patient. Whether you're in the exam room, on the phone, or at a patient's bedside, trying to see things through your patient's eyes and communicating respect will provide an atmosphere of trust. Only in that trusting atmosphere can the healing process begin and allow the patient to openly discuss a medical problem without worry of emotional or physical boundaries being crossed.
I think the most important advice for a physician starting in practice or even starting in residency is that the sort of care and feeding of the physician needs to take place outside of the office.
I think a good way of acting is to always be on camera and to say, if this were going to be played back an hour from now or 2 hours from now, would I be happy with that interview? Would I be happy with that contact? Would I be happy with what happened?
We tend to think of it being the other person that gets into boundary problems, boundary violations. However, we're all vulnerable. And it's very important to recognize our own vulnerabilities. It's very important to recognize when we're having difficulty.
We always come back to the same thing to a man, and that is, but I still like taking care of people.
You know, there's so many rewards of this profession that you cannot count. The most important being that you feel so happy when you're able to treat somebody and make them feel happy that you have done something.